This video will introduce you to the upper mid and thoracolumbar soft tissue supine position OMM technique. This technique is used to treat the paravertebral musculature and fascial attachments along the back. It's also used to free up the motion of ribs 4 through 12. We're going to have the patient on their back in the supine position, and this is good for pregnant patients or patients who can't lay on their side, so for the lateral recumbent position, or on their stomach for the prone position. This is called the upper mid thoracolumbar soft tissue supine position technique. And to begin, we'll have the patient bend their legs so their knees are up on the table, and then put their knees together, because we'll be using these knees as a counterbalance. Next, we're going to take our cephalad hand and reach under the patient so that our fingertips are on the paravertebral musculature, or the muscles, the longitudinal muscles that are just lateral to the patient's spinous processes, or just lateral to their spine. Now what we're going to do is we're going to work our hands in a kneading motion, much like I've shown you in other videos, so our hands are working in concert, but they're actually working in opposite directions. One hand will be using the knees as a counterbalance, and the other hand will be back on the musculature. And what we're going to be trying to do is the cephalad hand will be on that, the fingertips will be on that musculature along the paraspinal and paravertebral musculature along the spine, and we're trying to bring that musculature anterior and lateral on the patient, so up and out on the patient. We're really trying to relax those muscles and stretch them out. So we'll be doing a lot of this motion, almost like a wringing out with your cephalad hand. So here we go. Caudal hand on the patient's knees, cephalad hand on the patient's paraspinal muscles, and we're really going to try and work those muscles, bring them out and up, work up and down the patient's spine, really trying to relax that musculature, free up ribs 4 through 12. And you want to do this until you can appreciate muscle relaxation, tissue relaxation, or if you're working with a specific somatic dysfunction, until there's been some relaxation of that musculature. Enjoy the music.
Oh my God.